Hello, my name is Allison Bloom. I'm a senior majoring in communication disorders, and this is my Portal Practice Oral Presentation Project. So, after looking at the ASHA website at all the resources there, I picked a few different topics that I would be able to use in my everyday therapy as a future SLP. So, for the first topic of clinical tools or clinical topics, the one I chose was written language disorders. I chose this one because I thought it was really interesting in the fact that a lot of people think of speech language pathologists as just providing therapy for students or people with language disorders spoken. So, articulation disorders or different things like that. Not a lot of people know that they can actually help with things like reading, writing, difference between spoken language and written language, spelling, and then relationships between reading and writing as well. So, as an SLP working in a school system, say, I would be able to help assess that, provide therapy, as well as help students know different relationships between vowels, making good plans for them to keep them on track and kind of get them with the rest of their class in their reading level. When I was in first and second grade, I actually went to a speech language pathologist to help me with my reading and spelling. I had different spelling words, and it was really helpful. I did an assessment as well as some therapy with them for about 2 years. So I thought it was super helpful, and it would be awesome to be able to provide those different services as a future SLP in a school system. Also, something I found on the ASHA website, which I thought was pretty cool, is that you are able to actually help with handwriting assessments in therapy as well. You'll be able to work with an occupational therapist or other specialists to help students with handwriting disorders. So if they're not able to actually write the physical word, they may also have troubles reading it and spelling it as well. So I think that is another resource for people to use in their future therapy as an SLP. For professional issues, I chose telepractice. I chose this one because I thought it was very interesting and is becoming a lot more popular for a therapy tactic to use for clients. I think it's a really good resource, especially living in Nebraska. There's a lot of rural areas that may not have super close services provided for people that may have a communication disorder or a language difficulty. So, when thinking and using telepractice, something to know is you need to actually make sure that you are following all the same rules and regulations and procedures that you would be following if you were in a physical room with your client instead of over FaceTime or telepractice. So, keeping those in mind, you need to make sure that you are, like I said, following all the same rules as you would in regular therapy in a regular room, but also knowing your client as well. If you know that your client is having really hard time focusing or just gets distracted very easily, you need to make sure that you have the correct environment for telepractice as well. If your client just doesn't have the correct resources or anything, or maybe would have more effective therapy in a physical room with the client and the SLP instead of over telepractice, knowing your client and giving them the best resource for that is important as well. Next, for client-patient handout, I liked the area where they had a lot of different brochures and resources for families and clients as well. So, say I'm an SLP working in a school, which is my future plans. I really would love to work in a school setting. Having these different brochures that you can find right on the ASHA website to hand to families or clients is really important. They have different brochures on there, meaning with different information about an SLP's role in a school system or how an SLP can work with a child with autism, understanding aphasia, understanding hearing loss, knowing if your child has a hearing loss, different things like that. Lots of people sometimes don't know what a speech pathologist does, and maybe their teacher or someone might recommend them to go to speech therapy, and having that extra resources with a pamphlet that has detailed information or just an overview of how they can be helped within the school system can be really important. Also, tools and templates is also something I found on the ASHA website. The one under cultural competence is really important because I think it's important to be able to assess yourself and reflect yourself. So they have cultural competence checklists as well as policy and procedure checklists and service delivery checklists. So how are you providing therapy for the client? How are you providing information and other techniques for the family as well? So knowing all of these things and all of these tools, and knowing that they are all available on the ASHA website is a really important thing and can be very helpful as a future speech language pathologist. Thank you.